Since 2007, I have poured my heart and soul into this emergency department at California Hospital, and being the medical director here is one of my proudest things I've ever done in my life.
I love my job. I love being a nurse. Ever since I was in second grade, my mom saved that little picture. I wrote something for school, and it says, when I grow up, I want to be a nurse. So she kept that, and I have it framed in my house.
I came to California Hospital 17 years ago, and I fell in love with the community.
California Hospital provides me with the access and opportunity and resource to deliver a quality of care that is in line with my mission. That's why I choose to be part of California Hospital.
I had a patient, and she was asking me about my role. This patient is a teen mom, and I was telling her about how I had a patient also who was a teen mom who became a lawyer. And she was so excited, and I told her that you could go back to school, you could do it, and she was so inspired that she told me before she left the hospital that she wants to be a nurse. It really touched me because she sees the way she was cared for, not only by myself, but the doctors, the nurses, and she said it was a calling for her. It's just a little gesture that you made that you could do it. And this patient really took it on. Actually, the patient came back. She had another baby, and she was in school. I remember her going through the computer, and I'm like, I had to turn my homework in. I go, homework? She goes, I don't know if you remember me, but 2 years ago, I told you I want to be a nurse. So she's doing her general ed and just waiting to get into a nursing school. It's very rewarding. This is why I became a nurse, is to make a difference, one patient at a time.
I recently took care of a woman that had just a routine medical condition, and I didn't think twice of it. And on her way out the door, she thanked me, and she told me that years ago I saved her daughter's life. It caught me off guard because I just was taking care of a routine medical thing, and it was unbelievable that I had impacted her life in that manner, and that she remembered me from over a decade ago. And that reminds me day to day, taking care of patients one after the other, that what we do really does make a difference.
When we were discharging a patient in the adult floor, it wasn't even in the NICU. We were discharging a patient, and the patient didn't have shoes. And we looked in the clothes closet for the donors. We didn't have anything that fit them. Several nurses have gotten together many times for different parents, where maybe the parent doesn't have a crib, doesn't have any money for a crib. We'll get a fund together and we'll buy the family a crib. We'll buy the family a stroller, whatever they need. I talked to the manager of the department. I said, is there anywhere I can go and buy shoes? But it was a weekend, and the patient really wanted to go home. It makes me realize that something as insignificant as shoes for me means a lot to our patients. That humbles me. It makes me want to do more. So I give them my shoes.
The staff that works at California Hospital Medical Center is like none I've ever seen before. We are all here because we want to give back to the community. We could work anywhere, probably for more money in an easier environment, and we choose to work here because we love the hospital, we love the community, we love the patients.
This hospital has been a second chance to many, many, many patients in so many ways. How amazing it is to actually give to an organization that gives a second chance. A lot of organizations have this beautiful mission statement on the wall of their building, but the practice is completely different. In California Hospital, we live our mission. In fact, if anything, the mission is not written on a wall of the building. It's written on our heart.